Hi, it's Sky here, and today I'm going to tell you a little bit about what I know about medicine in Qatar from my own personal experience. Now I admit there are a lot of things that I do not know about medicine in Qatar because I haven't been pregnant, I haven't had cancer, I haven't had heart disease, I haven't had to go out and try to find somebody to deal with a mental illness. So remember, these are just a few of the things that I have experience with that I can talk to you about today. Now, of course, there's going to be a little bit of TMI, or what some people would consider TMI, or too much information in here. If you do not want to listen to this, please click away now. I will not think anything less of you for it. But do not listen to this and then post in the comments, ew, like, I can't believe that you talked about the fact that you have a heavy period. Like, no, I am warning you now, so just click away if that's not something that you want to hear. Alright, so I have a lot to talk about today, so I have organized it into particular places and types of doctors, so I can get my thoughts organized a bit more easily. So first thing I have to talk about is eye care, and to be completely honest, I don't have a lot of experience with this. If you had asked me in Korea, I could tell you a lot more because I did get an eye test in Korea and I had bacterial conjunctivitis 3 times in Korea, which was not nice, but that's neither here nor there. My eyes are very dry, but I can go buy eye drops for that, and the eye drops are a fairly reasonable price. The one thing I have done with regards to my eyes here is I have bought eyewear. I had to buy some contacts last year because I was in the musical Les Miserables, and of course plastic frames like this were generally not something that the poor people of Paris would be wearing back in that day. So I either had to basically not see on stage or get myself some contacts. Those were very expensive. Another thing I can speak to is getting prescription sunglasses here. Now, when I lost my sunglasses, I thought to myself, there must be cheap places to get glasses. After all, there's a lot of blue-collar workers here, and where do they get their glasses from? Well, I was not able to find that out, and I needed sunglasses right away because the sun here, the glare from the sun is really harsh and my eyes are really sensitive. So I did buy some new sunglasses and I have them here. I can show them to you. Here's my cute case. This is not from Qatar. And it says it's from a company called Redele. I think that's how you say it, Redele, which is not a very well-known brand, but these glasses were the cheapest I could find that I actually liked in some way, shape, or form, and they cost $350. Now, coming from East Asia, I used to live in Korea, came back to Canada for a year, now I'm living in Qatar. But in Korea, you can buy a basic pair of not sunglasses, but regular glasses for about $40 if that's what you're looking for. These glasses here, $40. So it was so price gouging to me to have to pay $350 for these. So please just, if you can, try to buy your glasses from outside of Qatar if wherever you are from or wherever you are visiting has cheaper prices. Okay, number 2 thing I need to talk about is the dentist. Now, if you need to find a dentist, my number 1 recommendation is to ask people, because you do not want just anyone poking around in your mouth, filling cavities, doing root canals, pulling teeth. Just ask around. Now, I go to Family Dental Clinic, which is on the south side of Doha, and I'm really happy with that. There are a few different things I've had done with the dentist here. I have gotten checkups, I've had cleaning done, and I had a night guard made. I also had my old amalgam, so my silver fillings taken out and then tooth colored fillings were put in. Overall, I've been really happy and satisfied with the service here. The thing is, I am from Canada, and some people think, you know, oh, because I'm from Canada, I don't spend that much on medical care. But the thing is, to see a dentist and get dental work done in Canada is so expensive. In fact, my insurance did not cover my night guard at all, but neither did my insurance in Canada. And my night guard in Canada was $800, and I really didn't like the fit of it and the material that it was made out of, but my night guard here was $350. So it's a huge difference. Now cleaning is probably a pretty comparable price. The checkup I felt was a little bit cheaper. The cleaning was actually near $100, but interesting thing is my insurance did cover a part of the dental cleaning, even though they did not cover the retainer, or I should say night guard, which is of course preventative care, because grinding my teeth at night is completely unconscious. It's not something that I can control. All right, numero 3. I'm going to talk about clinics. Now, I am not sure how other insurance works. I'm also not sure if it is just the clinics that I go to, but usually when I go to a clinic, I need to fill in some very, very basic paperwork, and then I pay about 50 reals. That is about $14 simply for the doctor to see me. The wait time does depend on the clinic and the time of day, but usually the most time that I end up waiting is about 30 minutes. As far as I can tell, family doctors are not really a thing here, but then they weren't in Korea either. I feel like a lot of places outside of Western countries don't really have the concept of a family doctor. Just like anywhere, the quality of the doctors here is really very variable, as is their bedside manner. There is one gynecologist that I dealt with though, and she was extremely rude. She was disorganized. She didn't even have in her file tests that I had previously done, and then was trying to prescribe me medication for a problem that I supposedly had a month ago, even though she didn't communicate that to me a month ago. And then she asked me what medication she had prescribed me in the previous month because she did not have a record of it. And she was very clipped. She had the most horrendous bedside manner ever. Like, after that experience, I just said to myself, I cannot go to that doctor. I don't care that she is the gyno who is closest to me. She's just a horrible, horrible doctor. I feel like I could do a better job by going on to WebMD in that particular position, and that's not a good thing to think or to feel about your doctor. But, you know, on the flip side of things, I went in one day complaining about, you know, tiredness and this and that and another thing, and there was a doctor who was really good, set me up with getting a pile of blood tests done, and really pushed insurance to get that approved. So, I mean, you have the two sides of the doctor coin, I guess, wherever you go. But that one doctor, again, worst out of 3 countries that I have been to now. Now, some clinics actually are able to perform some of their own blood tests and have a place where blood can be withdrawn in the clinic. But if you're getting some of the more specialized tests, you might have to go into a different place or a different clinic, or to go into a hospital in order to get that done. And some of the super specialized tests, they actually have to send to different countries to get done and to have read and to have recorded. So that is another thing to keep in the back of your mind. Number 4, hospitals. I have been to the hospital, well, I've been there a few times. Most of the time it's just to see a doctor, because one of the best places to get treated, to take blood tests, and to find a doctor, according to the people I have spoken to, is Ali Hospital. Again, doctor quality there can be variable. The inpatient care, however, I have to say is fantastic. Now, I did have an IUD inserted in Qatar. This was completely for medical reasons. I have extremely heavy periods. As a result, there is a low level of ferritin. That's basically the iron that is in storage in my cells is extremely low, and I'm not able to build it up because I bleed so much every month. And I've tried birth control, and so eventually I said, you know what, I really want to get an IUD. So I was in the hospital for less than 24 hours. I basically was put under, which is not usually done for people who are having IUDs inserted, but it was in my case. And they inserted it. I woke up in a hospital bed, and I was there for the day. I watched a bit of TV. It was a private room, beautiful, immaculately clean. And also the food was absolutely amazingly delicious, like best hospital food ever. The other time that I landed myself in the hospital was a dehydration issue. I do get dehydrated a little bit easily, and I actually had an IV inserted into my arm. This was at a hospital that was not as nice as the other hospital, but you know, in cleanliness and the way it looked, it just kind of looked like a hospital would look in Canada. So again, it's something that I was pretty used to. I was there for, I guess, 2 hours with this IV in my arm, and then I was able to go home, and they sent me away with this, a prescription for this one here. Now you can get this over the counter, and I actually really like this, again, because I get dehydrated very easily. This is called Oralite, and it's just meant to balance out your electrolytes when you need that kind of thing. It's not that tasty. Don't think that this tastes like Gatorade or Sports Aid or some other kind of sports drink. I mean, I drink this when I have to for medical reasons. Basically, when I get to the point where water is no longer quenching my thirst, or water and lemon is no longer quenching my thirst, then I will break this one out and I will drink this, because that is, I'm getting better at my body, at listening to my body when my body is telling me, you know, something's not right here. And then this is my first response to that. So still talking about hospitals, but this time about vaccinations. When I went to Africa, I had to get a lot of travel vaccinations. But not only that, I no longer have access to my Canadian health records. At this point, because of policy, I pretty much have to go to a city my parents no longer live in and physically pick up my vaccination records myself from Canada if I ever want to gain access to them again. So it's not very easy to get them anymore. So I figured it was a safe bet to not only get the vaccinations that were required for Africa, but to get all of my vaccinations again, and this time to get a record of my vaccinations. This was not cheap. I went to Ali Hospital, and it cost me $1,000 because adult vaccines are apparently not covered by insurance. Ugh. Now, thankfully, because I had the money, I thought to myself, this needs to happen sooner or later. I need a record of my vaccinations. I need to be vaccinated and know when I have to do the update for the vaccination. So, you know what, I'm just going to go ahead and do this so it's done, and then I have my yellow vaccination card, and that will be recognized around the world. So that's what I did, but I mean, it was insane, the entire process, the number of times I had to go in, the amount of money that I had to pay. But you know what, at the end of the day, you know, at least I have my health, and that's something that's an additional booster or protection for my health. So I just kind of think of it that way. Now, I've already talked a little bit about number 5, which is insurance. And I've mostly been happy with what insurance has and had not covered, but sometimes I find it a little bit strange. I mentioned the night guard before, yet getting money back for my teeth being cleaned. But my IUD was actually mostly covered by insurance because, again, for a medical reason I was having this put in. I just paid a few $100s for that one. Number 6, pharmacy. Alright, so first thing you need to take note of is certain medicines that are available in Western cultures or are available in Western cultures over the counter may not be available here. Some examples. I have never seen NyQuil. Now somebody may correct me on this one, but I've never seen it here on the shelves. Certain prescription stimulants are completely, prescription stimulants you would use for treating ADHD or maybe sleep disorders. Those, a lot of them are illegal, not Ritalin, but a lot of the other ones, such as amphetamines. Over-the-counter Tylenol or acetaminophen with codeine. Maybe that is available as a prescription drug here. It is certainly not available over the counter. But you can find a lot of the other things that you are looking for, or you can find versions of things that you might be looking for. I'm talking standard medicines like aspirin, regular Tylenol, extra strength Tylenol, things for indigestion, things for colds. I mean, you can find all kinds of those things here, vitamins, minerals as well. Another thing to note is that prescription drugs are generally much, much cheaper than they are in Canada, because that's another place where Canada really falters in Medicare. Is our medicines, our prescription medicines are incredibly, incredibly expensive. Also, here is a fun fact that I love about Qatar. Birth control is entirely over the counter here. No prescription is needed. Now, I do think if you get birth control, if it is your first time using a birth control, you should go talk to a gynecologist first to make sure, or even a regular general doctor, to talk about what your concerns are, why you are taking birth control, what you would like to get out of it, what you would like to avoid, and what your current medical problems are, so that they can direct you into a good starting place. And then after about a month, you should come back, and then maybe after another 2 months, you should come back again. But in my opinion, if you have already established yourself onto a particular birth control pill, you should not have to go back to the doctor so often to get prescriptions. When I was visiting my grandma in Ottawa back when I was on a birth control pill, I forgot my birth control pill at my parents' place, and as a result, what I would have had to have done is go to a clinic, a walk-in clinic, wait for about 3 hours because it was a holiday and not a lot of clinics are open, and then get a prescription in order for my period not to have been triggered by the fact that I couldn't take my birth control pill because it was not there with me. I say it would have had to have done, complicated grammar, I know, because thankfully there was a relative of mine who was in Ottawa, and she was a nurse, but she was certified to write prescriptions, and so she was able to write that prescription for me. But without her, I don't know what I would have done in that circumstance, which is why I love the fact that it's completely, walk in, pick it up, buy it, purchase it, and it's a lot cheaper here as well. So number 7 is actually not so much a point as a funny or possibly very painful story. So when I first arrived, I was sick for a few days. I went into a clinic. I had a raging, pounding headache. I was yawning. I could barely keep my eyes open. I was feeling dizzy. I was feeling a bit nauseous. And so I'm in there telling the doctor my symptoms. And then she says, and keep in mind here, I am a teacher, I'm Alice's mom, do you remember me? And I was just thinking, and it was one of those moments when I just wanted to slap my head down really hard on a desk and just hightail it out of there. It was not good. I have not been back to that clinic since because I would rather not that my students' parents be involved in that aspect of my life. Anyways, I hope that this was quite informative. If you have any questions about medicine in Qatar, of course you can ask me. You can write some comments down below. But again, there are a lot of things that I do not know about. So honestly, if I can't respond with an answer that satisfies you, or if you feel more comfortable or like somebody else might have more knowledge, I would suggest going over to one of the Qatar forums and writing something in the forum over there asking your question about medicine in Qatar. And by Qatar forums, I mean Qatar Living as my prime example. Anyways, I will see you later. Bye-bye.